Welcome back to another exciting episode of Grow Salon Multimedia, a platform where we showcase individual initiatives that create their own impact in order for our beloved nation to be developed. Today we have a very special guest in our midst that I will show you shortly. She is Dr. Sumaila, a dentist who has passion for oral health care and for medical development in our beloved nation. This person has created impacts for many years in this country, and she's ready to come talk to our viewers about healthcare, about oral health care, and what they should do in order for them to maintain their health, especially their teeth. Please join me shortly as I welcome Dr. Sumaila. Welcome.
Thank you so much.
Of course, today we are here again to talk to our viewers there, and of course your potential patients, for them to know much about what you are here to talk to them. But first of all, we want to know a little bit or more about you, so that viewers will know you more. Technically, tell us your CV.
Alice Khadija Sumaila is my name. I was born in the Southern Province, Mayamba District. So I entered the School of Nursing in the year 2002 and I graduated in 2005 as a state-enrolled community health nurse. After my graduation, I've worked in several hospitals in this country. I've worked in the Oladurin Children's Hospital, I've worked in Cottage Hospital, Maternity Hospital, I've worked in Connaught Hospital. I've also worked in a private clinic by the name of Lax. Also worked in emergency hospital because I want to diversify my knowledge. I want to learn a lot in different areas. But in 2009, I saw a vacancy from the GCPN, Global Connection Partnership Network, about hiring a dental nurse assistant. I went in for that application and I was called in an interview where I was given the opportunity to practice in GCPN as a dental nurse assistant. Since that time, I have got a lot of vast knowledge in dentistry and I've shown a lot of great interest. So therein, my boss sent me to India to go and acquire more skills. On returning back, I worked with Dr. Don Davis at Connaught Hospital so that I will get my license. So after acquiring my license and the Ebola breakout, we are still working in Connaught Hospital, but to maintain safety, our boss called us back to the center so that we can work in the communities on surveillance and giving stuff during the Ebola. So we are creating an impact also in the lives of people by then. Later, we started operating fully in this hospital now as a dental therapist. So far, that was how I bumped into the dental facility. But actually, before I became a dentist, my passion was to become a pediatrician. Okay. Because I love children, I wanted to be a child nurse. So that was my passion. But because of the way when I was sent on special unit, I went to the dental department, I saw how people were suffering. When I got this opportunity, I said, you know what, let me go and empower myself so that I will come and add to our nation. So that was how I grew a lot of interest in the dental field.
Wow, this is wonderful. Viewers, please stay to this channel, you get more of this. Dr. Alice, what are the key challenges that people in Ceylon face today in maintaining oral health?
Well, thank you very much, moderator. There are several challenges that people are facing. The first challenge is fear. They fear the hospital. They don't want to hear about dental. The moment you say dental hospital, in fact, nobody wants to go there because of the previous stories that we've been hearing, the trauma that has been done to people when they go to the dental hospitals, and also people are afraid of sterilization. most people have knowledge about this cross infection, transmission of diseases. So people do not want to go to the hospitals at all because they know that we are using instruments. So people do not want to come because of fear of nosocomial infection. By nosocomial infection, I mean acquired infection in the hospital. Like somebody coming from home with a dental problem, he or she returns home now with hepatitis or HIV and all that. So because of that, people do not want to come to the hospital. Also, there is something we call myth. Myth is false stories. False stories that people say, if you go pull eye coat, you teeth in the hospital, especially the last teeth, you will die or you will get deaf, you will get dumb. So because of that, people do not want to come to the hospital. So those are some of the challenges I feel people do not want to come to the hospital for.
Okay, thank you. Viewers, please share to viewers the address of the dental clinic.
Our hospital is situated at Jui, opposite the Bible College. We have one tech Bible College. Just opposite there, we have GCPN Dental Hospital. You can find it right in Jui community.
Okay. Thank you. Why is it necessary for people to prioritize dental care?
Well,
how can that create impact?
It is necessary for people to really prioritize dental care because there are plenty faculties, plenty things that are happening to people that they do not aware that it is caused from the lack of oral health. Number one, halitosis, that is foul smell. Some people come to the hospital, they say they have foul smell that is coming from their stomach, and that is not true. When you eat food, it accumulates in the teeth or in the mouth, it gets rotten, which we call decay, and it begin to decompose. So that decomposition of the food makes it very offensive. It's just like eating in a plate. If you don't wash it immediately, you keep it for 2 days, it will decompose. If you open it, foul smell. So that is one of the reasons. Number two, there is a very serious condition that is affecting people in this nation and they are not aware of, which they call dental abscess. The moment they start getting swelling of the jaw, it progresses and bursts out and begin to ooze out pus. They don't pay attention to it. They begin to say, this is not ordinary. They have sent sick on me. People will begin to say it is so sick. They will say all sorts of things. And they will go different places in search of medical care. Some will go to Mama Kadiatu, some will go to Pasori, some will go to Sorcerers, all these people just to get healing. But the more they go there, the more they become sick. So most of them have died because of that dental abscess. Dental abscess is just from toothache. Your teeth start aching. On the first outer layer, they don't pay attention. Second layer, the teeth is paining, they start to take medicines. They apply medicines. It goes to the third layer, which is the pulp. Eventually, when it reaches the apex of that pulp, which is the end of the root, it will form an abscess or a boil. This abscess will find a fistula tract. This fistula tract means it won't burst outside. So if they don't pay attention to it still because of ignorance or whatever, it will burst out and start oozing. Because we have a lot of adipose tissues on our jaw, you have these parotid glands, you have all the glands around there, will not allow healing to take place easily. So that kind of person will live throughout with sore, with pus oozing out. If you can check around the community, you can see people with plaster or bandages around their head. It is caused from toothache. So those are some of the problems. As I said, foul smell, if you are in a car with somebody or in a bus, commercial vehicle, they really like to talk here. The person, those that have that foul smell, they like to talk a lot. So they'll be talking in the car and they will inconvenience everybody. Nobody wants to tell them, stop talking, your mouth is, so they'll just turn their face. So we don't want people to continue suffering like that. We don't also want even your spouse to turn away from you, your friends to get away from you. So we want them to prioritize healthcare, oral healthcare, so that they won't go into real problems.
Okay. So what are the services that you currently render at the Hope Center Dental Clinic or GCPN Dental Clinic?
Well, our services is basically prevention. When you come to the hospital, we give you oral health education. But before we start any procedure, we do our basic vital signs. When the Ebola break out, we don't do vital signs using the cough, the BP machine, because we don't want to contaminate it. So what we do, we normally use the glucometer to check the blood pressure and the blood sugar of elderly patients, because some of them have these silent killers they don't even know, like diabetes and hypertension. For the hypertension, we ask, do you have high blood pressure? If you say yes, we ask you if you've taken your medication. If you say no, then we encourage you to take before we do any procedure for you, because the anesthetic that we use have epinephrine, and if your pressure is high and we give that, it will cause problem. Also, we do the blood sugar ourselves to see if the patient has high blood sugar level. If he or she has, we will pre-medicate the person before ever doing a procedure for that person, because if the patient is diabetic and we pull his or her teeth, the healing process will be very slow. People outside will not know that is his condition. They will say that hospital do not know how to perform procedures well. So since they pull my family member's teeth, up till now no healing process has taken place. So to be on the safer side, we do those basic vital signs so that we don't go into problem. Then also, if a patient comes here with tooth problem, that is, they will say, me teeth they hurt. If they come with that kind of condition, we check the teeth. If it has gone beyond repairs, we will not keep that teeth in the mouth for fear that it will progress to dental abscess. So we do an extraction. An extraction in our facility is a painless one. When you pull your teeth, you will not feel any pain. If the person only has a cavity on the teeth and it is not in the third layer, which is the nerve, we clean that one and we put a filling, no problem. If it is in the first layer, we clean and put a filling, no problem. But mostly when it is in the second layer, the nerve, there will be the dentin, there are some dentin are tubules, nerve endings, so there will be an amount of pain. So what we do, we clean the cavity and we put one medicine we call base liner. So that base liner will produce a hydroxyl acid, which will produce new dentin. So it will not go closer to the nerve, and that teeth will be healthy again. So we save that teeth. So we basically do examination. We call it diagnostic and examination. We do extraction if the patient's teeth is beyond repairs. We do cleaning, which we call hygiene, scaling and polishing, and root planning. Then we also do these fillings. So those are some of the facilities that we offer here.
This is Grow Salon. Please stay glued to the channel, subscribe and share for others to see the importance of this very information. I know at the end of this discussion you will give us practical of how you do, but please give viewers a tips of recommended things that they should do, practical tips.
Well, like for practical tips, we want them first to visit the hospital, because when you come here, you will see a vast difference of what you've been doing out there. In the first place, when you come here, we'll teach you the type of toothbrush that you will use to clean your teeth. Most people are using that smoker's toothbrush. They think that is what will clean their teeth. When you come here, we will show you the correct toothbrush that you will use, the correct toothpaste that you will use, the number of times you brush your teeth so that it will remain healthy, how to floss your teeth last into bed before or after eating. Then also, we will show you, we will do this test for you, so that most people have identified that they are diabetic through our hospital. So those are some of the tips we'll give you. If you come here, you will really enjoy it.
Of course, the address again is 111 Hanga Road, not Kenema. 111 Hanga Road Jui. Just at the junction, you take motorcycle that you are going to GCPN, opposite the Bible College, the TECT. TECT is the Evangelical College of Theology. Just there you will see the gate, and that's GCPN. In this video description, you will see the affordable prices that they will offer. What this video will give you contact that you will call to know more. Stay to this video and we'll be back. Welcome back. Please share this video. Let others know the importance of oral health care and let them share to others. Dr. Alice.
Yes, sir.
Please, how can viewers or people in Sierra Leone or the whole world prevent common oral health care problems and emergency?
In the first place, they should put aside that problem of saying they don't want to come to the hospital. Let them visit the hospital every 6 months. If they come to the hospital, like our own facility, there are lots of things we can do for them there. Some of them have problems they don't even know. They'll be passing with the problem. When you ask them, how are you? They say, I'm doing fine. So I normally tell them, I say, look at the problem that you have in your mouth. And when they ask you, how are you doing? You say, I'm doing fine. Nobody knows their problems unless you come to the hospital for a thorough dental checkup. Therein, you'll be able to identify. When you come here, the cleaning technique that we show you will help you prevent all those problems. It's just a basic necessity, because for you to have a dental problem, you need to have teeth in your mouth. Number one, you need to have a mouth. Number two, you need to have teeth in your mouth. And number three, you need to have eaten something that will stick around your teeth, which will decompose or decay, and in other words, rotting, and produce water. That water is very acidic. So that is the water which burst hole on our teeth. That is how we get it problem. So to avoid that, you need to come to the hospital on a regular basis, like every 6 months for checkup, so that if we identify any problem, we'll be able to take care of that. So that is one of the preventive measures. Another method is the cleaning technique. People used to tell me that, they wash me mouth fine, 2 times per day, but that is not enough. And some people, when they come here, I'll ask them, how do you clean your teeth? They start teaching us the wrong way of brushing. So the way they are brushing is the plastering method I normally tell them, or it is the power saw type of method. And that method is causing a lot of abrasions on their teeth. And those teeth become very sensitive. If you drink cold water, it's too sensitive. You drink hot water, it's really sensitive. So to prevent all those problems, we need to visit the hospital, especially our own, because we prioritize all those things. We make sure we teach you the correct brushing technique, we teach you the preventive measures, and we teach you other procedures that you can apply so that you will not get it problem.
Stay to this video, because at the end of the video you will see, because I'm also confused. I need to know this power saw method they are talking. I don't know what it is, but at the end of the video we will know. Watch the video unto the end, you will see the methods or the techniques that she's talking of. I believe this clinic has the best staff, the best team, and the best that they will teach you and make sure that you have a very wonderful oral health care. How do you contribute to raising awareness about dental health in Sierra Leone?
Well, before we started this hospital really functioning well as a dental clinic, we are doing outreaches. We are going to schools, institutes where we teach oral health. We teach oral health, and we don't just teach them the technique, we also do sample placement, because we will not teach somebody something and you don't give them the thing that we use to do the procedure. So each school that we go, before we go there, we go and do a pre-survey to know the number of students that are in the school or in the institute. Once we get that figure, we bring it back. Our boss and the others will purchase the toothbrushes and toothpaste, then we can take it to the facility. Once we teach them the correct oral health education, we teach them the correct brushing technique, then we offer each student 1 toothbrush and 1 toothpaste free of cost. So we've been doing that. We've been also visiting non-go areas in this country where medical facilities, very, very
far, hard to reach areas.
Hard to reach areas. So we have to find our way through. Some areas, if you see us, yes, going up and down like the Warara Chiefdom. So when we go to those places, very, very challenging, but we sacrifice our own lives just to help people. So when we go to those communities, we teach them our health education, we assess those that are in need of healthcare, we provide healthcare for them. Those that need extractions, we do that, and we give them free medicines. We don't take a single 1 cent from them.
Yeah, please, to be clear enough, GCPN is a non-governmental organization that have a dental care department that is registered with the Ministry of Health or the Medical Dental Council. So it is not a profit-making dental clinic. It's just a cost recovery basis they are operating. What you pay here is not comparable to what people pay out there. We do our best here because we want to develop this country. How do you deal with children? Because if elderly people are afraid to come to the hospital, how do you deal with children? Because I know they are much more afraid.
Well, for not only children, all of them that come here, most people before they enter the clinic, they are already crying. So I normally tell them, "Oh, I've not done anything to you, I've not given you pain, why are you crying?" Okay, I'll tell them, I say, "Okay, now let's do this. Receive the pain before you cry. Will you agree?" They say yes. Okay, I say, when you come here, don't cry when you've not received the pain. If you receive the pain, then cry. So for the children, I have toys here that I show them. Sometimes when I put them to the chair and put them in a very comfortable position, I start to sing for them. I will ask their name. "What is your name?" He or she will say, "My name is Precious." Then I say, "Me too, my name is Precious." So we start building that human relationship. Once the relationship has been cordial, I start to teach them first. I ask them, "How do you know how you got this problem?" "Okay, now show me the problem." They show me. "How did you get the problem?" They don't know. So I start to teach them. After that, I'll teach them now the brushing technique. So by that, I allay their fears. So I do that to both children and adults. So once you allay their fears, they feel more comfortable for you to give them procedures. And when I'm doing my procedure, I show them the anesthetic that we use. It is sealed, it comes in this package. So I show them, I say, "You see, it is sealed and sterile. When I open it, if I put it on your skin, as soon as it touches your skin, the whole skin will be numb. There will be no pain. So if I do my procedure, you won't feel any pain." So they feel relaxed. So I will do my procedure without any pain.
She is Dr. Ali Sumaila. And check for contact in this video description. You will see how you locate this dental clinic. But to be clear, it is located in Jui, 111 Hanga Road, just opposite the Bible College, the Evangelical Bible College in Jui. When you come at the Jui Junction, just take a motorbike and say you are going at GCPN. GCPN exactly is where they will bring you. You will enter and then you will see the people that we are talking of. Check for contact in this video and you will see more. How do you encourage patients to be anxiety free? Because when they come here, immediately they begin to see those, I don't know how you call those tools. They will change their mind. Some even want to go back home. How do you create that environment for them to be calm and then you do the procedure?
Well, there comes the code of dentistry and ethics. Once you are trained and qualified, you know how to apply ethics to your patients because you have to make sure you reassure them. So reassurance is one of the key that is moving this hospital to and fro. And each patient that comes here will tell me that now somebody directs me here, I quote. So I normally ask them, I say, "Somebody directs you here, right?" He say, "Yes." So let's say this. If that person was traumatized there or I did very bad work for him or her, will he or she direct you the person will say no. So there, right there, I start to reduce the anxiety. So as total patient care is concerned in medicine, my goal as a caregiver is to treat my patients with respect and dignity. And I feel it an opportunity, a privilege to take care of the most important thing that is on earth, which is human being. So human being, the greatest personality I am taking care of, I take that as a very important, something I cannot mess with. So taking care of somebody who God said he made in his own image and likeness, if I don't be careful to take care of that thing, I blame myself and I feel guilty. So each patient coming here, I treat with respect and dignity, and not forgetting the code of dentistry and the ethics that I've learned in school, both in nursing school and the dental school. I will never forget that. So I apply that to my patients, and by doing that, I allay their fears. When they come here, they feel more comfortable with me, and when they are coming, we are like enemies, but when we are going, we are like friends. Most of them do pray for us, they thank us, they appreciate us, so which means we are doing good job. And we've never advertised this place, because the reason being, we want the place to advertise itself, meaning if we are doing good job, patients keep coming. And why we don't advertise? Because we don't want a large flow coming in at the same time. Will not be able to maintain the sterility, will not be able to do quality job, will not be able to pay more attention to the patient that we have on the chair. So for that reason, we did not advertise at all. And as you rightly said, this place is not a profit-making organization. We are not here to see 100 patients per day. If we see 2 patients and we make sure we treat those 2 patients very well, and we send them home in a very satisfactory condition, we are okay with that. Than to see 100 patients, then we send them home with half enough poor quality job. We don't want to do that. So that's how we treat our patients here.
Wow, this is very wonderful. There are people out there, because from your CV, people are out there watching that might be so much interested in achieving this achievement you are explaining. How do you encourage young people that want to go into the field of dental?
Well, that has always been my dream and my goal. Before I became a dental therapist, I was a nurse. I love my nursing, and most people that come here do not know that I went for this training. So some still call me Nurse Alice. I like it. I've never squandered them. I've never said don't call me Nurse Alice. I'm proud to be a nurse because I suffered for it, I worked for it, and I've put a lot of effort in it. So if you call me Nurse Alice, I appreciate it. Also, when I went to acquire my dental skill, I came back. You know, I have that in mind that one day I will be old, I will retire from job, I will die one day, I will retire from this job. So if I don't teach young ones how I'm doing my procedures, if I die or if I retire, who will do it?
You go with your ideas.
Yes, I go with my ideas, and I see it's a selfish entity if I don't teach others. So presently I have 2 young ones with me that I'm teaching small. I'm letting them watch, and I'm praying that one day they will get the ability, or they will get the facility to go out and study, so that they too will get their certificate and license, and they practice like me. Because you will know everything, you will know the practical, but if you don't have your license, you will not practice. Yeah, so I'm praying for them that one day,
if you attempt, it's a crime.
It's a crime. So I'm praying that one day God will touch donors to donate for them, to send them to go and study, so that we'll get good and devoted, dedicated young ones like me, because I love my job and I don't want to go without it. Every day I want to save one life.
2009 and now it's 2023. You got your license in 2014, right?
Yes.
So it's been, let me say, 8-9 years now. Mm-hmm. You are practicing as a full-time dental therapist.
Yeah.
What are the success stories?
Plenty. In the first place, I want to take this opportunity right here to tell God thanks for what he did for me. Because as I said, my passion was to be a pediatric nurse, not a dentist. But when I went to dental clinic during my housemanship, the trauma that I saw, the way I saw people who are suffering, some do not have the money to afford. Then I found myself in a ministry, a mission hospital. So I thank God for giving me this opportunity and this job. I say thanks to the Restore Hope Center, the GCPN, that sent me out to go and do this training. I appreciate them so much. I pray that God will continue to touch them to empower more Sierra Leoneans to be like me. The success story is too much. Since we opened this hospital in 2009 to now, we have never got a post-traumatic complication. By that I mean, if you pull one patient teeth, he or she go and die, or the patient come back with a complication. We've never got that problem. All our patients that come here, they get their treatments, they go home, they get well, they will come again, because we have our charts here. When they come, we write everything that we identify. So small they will be coming. When they come for extraction, the next time they will come for their cleaning, the other time they will come for their fillings. No one has died. And as for the dental abscess, that swelling that they come with, most people, in fact, this hospital is becoming a spot for the dental abscess now. Most people that come here with the dental abscess, they go back well. So most of them, when they come, we show them. We don't want to disclose the privacy of our patients by telling them na so, but we normally snap them. We take short videos so that when another person comes, he or she is not confident. Because when you start treating them, they are not sure that this is hospital sick. They want to still go back to the native, to the traditional healers. So we do encourage them by showing them videos, showing them pictures of the before and the after. So that has helped a lot, because they keep coming. It's not easy to treat. Some will be with us over a month. They will be coming on regular basis for treatment, aggressive antibiotic treatments, and cleaning, supported by the extractions, because once you do not pull the cause of the problem will still be there. So once we continue treating them, the swelling subsides, then we do the extraction. After the extraction now, small we continue with the treatment until the patient gets well. So that's how we do the therapy. But actually we have a 90 to 95% success stories. We have videos of those which we will not disclose to the public. We have pictures to the effect before and after, which we share to our donors, because the donors need to see what they are doing in the country. Because as I said, it's a non-profit making organization. We are just doing cost recovery.
Yes, so thank you very much
for
analyzing things for viewers out there. And this is a very wonderful thing you have done for people out there. Please share this video. This video should go far and wide for people to understand the issues we face today, and some will misinterpret it to another thing. I'll go to that place. This is not hospital sick or whatever. So, but why people might want to know, why do people get swelling, or why do people feel sensitivity in their teeth? Because I too have gotten that issue before, and I came here. I was dealt with properly. Exactly. So, but let's viewers understand what exactly are the problems, that why people face those problems.
Okay. Tooth problem, as I said, you need to have a mouth, teeth, and eating food. Most people, when they eat food, people eat a lot. Okay, before breakfast, you start eating till lunch, till dinner. Most food produce acid fast, especially the sugary foods. So if you don't brush your teeth like 3 times per day, you have holes in your teeth before you brush, because some people say I brush twice, in the morning and at night. So if you are brushing in the morning at night, then you've eaten in between sugary foods. This food in like 4 hours will produce acid, and this acid will burst hole on your teeth. So before you brush your teeth at night, the hole is already there. So in the hospital here, we recommend people brushing 3 times per day, before breakfast, after lunch, and after dinner. So what causes sensitivity, as I said, is the wrong brush and the wrong brushing technique. That one will be taught in the hospital when you come here. When you come, we'll teach you what causes sensitivity and how to prevent it and how to fix it, because it has already happened. Yes, so as we dealt with you the last time, we deal with them also. Let them just come to the hospital at Jui, GCPN. We'll do the examination. So if they are having that problem of sensitivity, around their teeth is bruised, they have holes in their teeth, let them come. Because once you have a hole in your teeth, it will start paining you. So if you come, if it is not in the nerve, we'll do a filling for you. If it is in the nerve beyond repairs, we'll do the extraction so that you don't get the dental abscess. The dental abscess is the one that causes the swelling. As I said earlier, the problem is on the first layer, they don't pay attention. The second layer, they don't pay attention. The third layer, with the pulp valve, the nerves, the capillaries, the veins, and all that. So when the problem goes to that and to the cementum, it will progress to the roots, the apex of the root. And once the problem has got to the apex of the root, it forms a fistula tract. So it will form a boil, or we call it an abscess. So that abscess is the one that causes the swelling. So that is how they get this teeth problem.
Yeah, because the last time I saw someone to...
Yes, and the only solution is the extraction. Even if you go to the highest sorcerer in Kabbalah, you will not get healing unless you come to the dental clinic. We put you on aggressive antibiotics, and here there is a miracle happening here. People do not know. The same medicines that we are using here, other hospitals are using them as well, but people are just getting sicker and sicker. But when they come here with prayers, with our dedication, with the aggressive way we do our combination, the patient gets the swelling subsiding gradually until to a point where we can do the general cleaning and do the extraction. So our success story is really based on depending on God for everything that we do here, and our commitment to our job, and we do it with a whole heart. We don't do haphazard job, and we are not running after the money. We always tell them that money lasts. So we put our patients first. Some come here, they don't even have money. Most of them tell us, I don't go spend, boku side I could. So when they come here, they don't have money to even buy the medicines. So most of the medicines are purchased, and we keep them here. When you come, we don't send you home to go and buy medicines. When we do our procedures, we send you home with your medicines because we don't want to get complication. And also some you can write prescription for them, you give them. When they go, one, they don't have the money to buy it. Some, even if they have the money to buy it, they are careless, they will not buy it. So some people do not add value to their life. Really, we are pleading to the viewers to pay attention to oral health. Oral health is very, very complicated. You will not know until one teeth begin to ache. You will not sleep, you will be uncomfortable, you're not able to eat. In fact, that teeth will be longer than all the other teeth. Anything you do, you just bump into it. And if your teeth is aching, there is no magic about it. You do root canal, at the end of the day, you have to pull it. And when you lost one teeth, dentures are very, very hard to manage. When they put one denture in your mouth, if it is a fixed denture, it starts to smell. If it is a partial removable denture, young ones do not use it. They can go and spend all their money to make the partial removable denture. But at the end of the day, they keep it, and the rats, they like it. They will just take it away. So we appeal to you viewers to visit our hospital in Jui so that you can identify the problem that you have. Some will say, I've never pulled in teeth before. Those are the type of patients we want in this hospital. Once you've never pulled teeth before, we encourage you to come. Once you do your basic cleanings every 6 months, you will grow old with those teeth that God has given you, your 32 teeth. You will not pull any, and you will enjoy your meal. Because when you start losing the teeth, all the teeth has is function. We have the biting teeth, we have the chewing teeth, we have the one that will form the bolus. So digestion starts actually in the mouth. So if you are not having good teeth in your mouth, digestion will be very poor, and your body will not grow well. There will be malnutrition, poor hygiene, all that, you see. So it's good for you to visit the hospital where you can learn a lot.
Wonderful. Yes, I like the way you treat patients. The last time I came here, you prayed before you did whatever you have to do. That alone will encourage patients to know that you put God first before whatever you do here, because God is the one that has provided every instrument that are here through the donors out there. Of course, here is discipline again, but it's also called Restore Hope, because these people are here to restore hope to you viewers, to people that are hopeless, people that come here for hope, not just for financial breakthrough, but your oral health also gives you hope. That is very, very important. Please, you have heard from her. Let us take our oral health care very important. We are now coming to request to her to give us a tour of the clinic, and let's hear about this. How do you call that? That's power saw method. I was hearing that power saw method. So come with us.
Okay, before I go with you, I want you to also know that when the patients come here, we want to give them psychological comfort.
Wow.
By brushing their teeth well, it will allow you to talk to somebody. He or she will not turn his face. You have glowing teeth. The teeth will be shining in your mouth, because when something is clean, light will pass through. And when light pass through, it will send light back and the teeth will shine. So if you have a clean teeth, healthy teeth, you will have psychological comfort. You will not be afraid to open your mouth anywhere.
Smile.
You can open your mouth, you can talk to somebody.
Comfortable.
So this hospital is there to give you psychological comfort. So we encourage you to come to this hospital where we can clean your teeth. We don't do whitening of the teeth, because I call it a fake job. Doing whitening of the teeth is rubbing paint on your teeth. It can change the color of your teeth, but it will not prevent halitosis, which is foul smell. In fact, when they paint your teeth, you will not be able to floss. And funnily, God made our teeth with every space in between each teeth. We call it interproximal areas. Those interproximal areas is where the food stick. So you need to floss in between. So when they do that painting of the teeth, they call whitening of the teeth, they close the interproximal area.
Okay.
So what happens? The food travels underneath and goes and stick there, which is very, very, very wrong. It is not good. So our own clinic do not do fake job. When you come, you say you want to do whitening of the teeth, we say we don't do whitening of the teeth, we do cleaning of the teeth. If God wants you to have white teeth, he would have given you white teeth.
Clean.
Funnily, our teeth is colorless. It is not white. What we see outside is the enamel, and the enamel is like glass. Once you have that glass, it is transparent. What you see inside is the second layer and all that. So the second layer, which is the dentin, is yellow brownish in color. So as you grow mature and older, your teeth begins to change its color. The reason being, every day we brush our teeth, we wear the enamel small, small, small. And because some people use that vigorous way of brushing, as I said, that strong brush and that power saw method, this is the power saw method.
Okay.
This is the power saw method. So once they use that power saw method vigorously, they think that will clean their teeth. The more they make their teeth yellow, because they have worn out the enamel. And once you wear out the outer layer,
it's like, let me say, now like water paint.
Yes.
With some water there. Is that not so?
Do you have a motor car? Do you have a car?
No.
Okay, if you don't have a car, your uncle's car out there, go and take pot scrub, that pot scrub, and start to clean the glass with it. What you will do to the glass, you will just scratch everything, the same we are doing on our teeth. When you use those strong brush, you wear the enamel and you expose the dentin. And the dentin plus the pulp is red, the nerve. the blood vessels, the capillaries, they are like blue, yellow. So all those colors mixed together will reflect on the glass. So that is why as you grow older, like my own teeth, it is not white, only that it is clean. If I make it like this, it makes that sound very clean, but it is not white. My teeth is like yellow in color. So we encourage people. You want me to see that monkey? Bring it for me. You can come with the other teeth over there. There are 2 teeth in there, the adult teeth and the baby teeth. Yes. You can still bring the adult teeth for me in that other room. So we have 2 different colors of teeth here. This white teeth is actually baby teeth or the painting of the teeth. If you watch keenly, you will not see any interproximal area in between here. The paint has already blocked all the interproximal areas. It has blocked it. So let me just have this. Okay, good. So look at the one God made for us. God made, this is a dental floss. This man said we should do some practicals. So for the one that God made, look at the adult teeth. You see its color is now brown, yellowish in color. So because the person has worn out the enamel because of hard brushing technique, even not hard brushing technique, every day you brush, you wear your enamel small. So now this is adult teeth, an old woman or old man like Dr. Alice. So look at the in-between. Every teeth here has a space. You see that? Every teeth here has a space so that you can floss. So this is the normal teeth. That's how God designed our teeth. A clever God. We are wonderfully and fearfully made. Look, you see how God made, so that you can clean in between these teeth and pull any food particle that is in between. So these are the 3 colors of the teeth. This is baby teeth, or the one that they paint. This is the adolescent teeth, like your own teeth has color like this. And this is the adult teeth like Dr. Alice. You see this one. So those are the type of teeth. This also is the adolescent teeth. Okay. So these are the colors of teeth. So when you come to this hospital, please don't expect whitening of the teeth. We will not do it, but we clean your teeth. You will not have any plaque around your teeth. Your plaque is the soft food that you've eaten today. Tomorrow is plaque. It is soft. But when it mixes with the mineral in your mouth, the calcium, the potassium, and all the minerals in your mouth, it calcifies, so it becomes calculus. So crab in Creole, we call it crab. So that one is what we remove, we clean. So we remove all those around your teeth, and we teach you the correct brushing technique. The correct brushing technique will not be taught on this forum. I'm sorry, I'll not do that. They need to come to the hospital. Yeah. So if you want me to take you around now, I will do that.
Thank you so much.
You're most welcome. So this is my dental area. We have our dental unit here. This one is a basic unit on its own. Every patient that comes here, we take as a suspect. Suspect, I mean, you don't know the patient's condition. Even if we do the medical history, we ask several questions. We ask them, do you have HIV? He will say no. Do you have hepatitis? He will say no. Nobody will answer. Only few will answer. So if we don't take our time, we don't be careful, we are going to infect ourselves, we infect our patients, and we infect our family members. So what we do here, we take every patient as a suspect. So in that light, when we are walking here, we make sure we protect ourselves. Every morning, we have our dental cover. This is our dental chair cover. We cover it. And this one, we change in between patients.
Every patient?
Yes, not every patient.
Yeah, come on, join us.
Yes, we change in between patients. Yeah, give it to me. We change in between patients. We have our sunny cloth here. This is our sunny cloth. When a patient gets up from the chair, that is why we don't want to advertise, because we don't want plenty people waiting outside. We want to give quality care. When the patient gets up from the chair, our assistants will take this sunny cloth and he or she will clean the chair very well. This sandy cloth is a germicidal disposable wipe. It kills 99.99% of germs, bacteria and viruses. So we use this one to clean the chair. That's the first thing. So once he or she is doing that, after I finish with my patient, I take the instruments to the tap. So in the morning, this is our trash bag. We put it in the basket. We put it here. We make it neatly. So we keep it here. So at the end of the day, with gloved hands, we just pull everything, blood and everything, and we put it in the incinerator where we can burn. Of course, we have a lot of gloves. You can just watch. We have a lot of gloves here. As glove is getting finished, we buy again because we don't want to manage. Come here, please. So in the morning, I have my glove corner here. I pick my glove, wear it, and I do my procedure. Once I'm done with my procedure, I have my marks over here. We have the patient bib. Every patient that comes here receive one of these. This is disposable. We don't reuse it. No. That is why you see it neatly packed. Once you open it like this, you open it, you put it on the patient's chest to prevent blood or saliva or anything getting into the patient's dress. We don't want the patient to go home dirty. Once we finish, we just trash it. We are done with that. Everything we have here, if we are using saliva ejectors, we have clean and sterile saliva ejectors here. All are kept so that dust will not go there. We have the marks, of course, this is for us. We use that. Sterile areas. This one you've seen here is preparing water. If you can hear that sound, this one is preparing our sterile water. This water we use for the autoclave. So we prepare that because before this time we have been buying distilled water in the filling station. One, because of cost, and because of it was not too clean. It was destroying our autoclave. We lose 2 autoclaves like that. So now we prepare our own water here. Then also, now I've finished with my patients. We have the trays. We have the trays that we use for the patients. Each patient, we have the paper towels. We remove that and discard. The instrument comes straight to the tap. It comes straight to this tap. It comes straight to the tap. So once I'm done with the patient, on the running tap with my brush and my soap, I'm just explaining. That's why I don't have gloves on. But when I'm doing my procedure, I don't even try it. I wear my gloves. So with gloved hands, I wash my instruments. And the instruments have beaks. So we open the beaks. I do it myself because I don't want to even give it to a second person I don't trust. I know he too is learning from me that when he or she finish the procedure, because of his IPC training, he has his IPC knowledge in his head. That is infection prevention control in his head. He don't want to infect himself and the patient. He will make sure he washes it, God watch it, you know. So with gloved hands, with the brush, you wash very, very well. This is our ultrasonic. Every morning when they come, they fill this with water, and we have our sanding tab here. You see this tab? Once it's finished, we fill it. So every morning we drop this in the water. One, it changes the color of the water because it's a chemical. So once it changes the color of the water, that chemical is going to help me. Perhaps I washed the instrument, but I left a bit of saliva or blood on it. So this instrument will titrate. This sound will titrate the instrument very well, and it will remove all the plaque, the saliva, and the tartar from it. After that, we have this barracks. This one, it cleans the surfaces. So when the patient gets up from the chair, and my own surrounding, my chair, everything, my assistant will clean with these barracks. Just spray around and it will clean. From there, once we finish titrating, because when it rains, it will stop. So once once it stops on its own, that means it has gone through the circle. Once it's finished, we will raise it up with glove hands. We rinse off underwater because we don't want the blue water to enter into the autoclave. It will spoil it. So we rinse it. We don't rush. We are not rushing. We don't want to make 300 million per day here. We are not after the money. We want to save people's life. So some people say, let's make this hospital not a full up until they not sabi their work. Until they not sabi their work. That's not the reason. We want to take our time because, as I said, if we treat 2 patients per day, we are okay with that. We don't want to treat 100 patients and we infect them, so we take our time. After we finish, then we send the instruments into the autoclave. As you can see in the autoclave right there, even the balls that we use, we sterilize them. Even the handpiece that we use. So if you watch here, the handpieces, everything is being sterilized. So this one is in the autoclave ready for sterilization. And if you watch here, the sterilization, we titrated it to the highest degree so that the circle will run at a very high degree so that it will kill all the germs, the viruses, the bacteria and all that. So once we are done, we remove it. This is, we call here the dirty room, the dirty area. We take it to the clean room. It's not that this room is dirty, but that area is dirty. So come here, please. So we call this area the clean area. Just point and start for me, LMC. So here's the clean area. We keep our instruments here. They are, I'm not going to open it. We keep our instruments here. They are all in sterilization pouches. You see these pouches? So we keep them here. They are sterile. We cover it and we cover it like this, and we cover it so that dust will not go on it, and we also cover it for a second opinion. So that's how we keep our instruments clean and sterile. One, because we too receive our care here. We touch them. We don't want to die young. We don't want to infect ourselves. We don't want to infect our patients. As I said, we don't want to send our patients home with nosocomial infection. And we don't want anybody to have problem here. So we take our time, disinfect. We have a lot of disinfectants. In this other room again, you have the barracks here. This is our sani cloth. This is our sani cloth that we use. It is wet to clean surfaces. We have this other I just finished. We have another one here. All of them are just surface cleaners. Of course, we have our soap, everything. We have our vim, just to clean surfaces. Of course, this is our sharps container. As IPC students, we know how to segregate our dirt. We don't put the sharps and everything together because we don't want problem. So all our sharps, as soon as we finish with the patient, we send it to the sharps container. So that's how we operate here. So viewers, feel free to come and get yourself treated in this hospital. It's not a business hospital. It's not a profit-making organization. We are just, so today is not a working day. So we can go to the other room now. I'm just showing you. So, what again shall I say? So as I said, it's not a non-profit, it's not a profit-making organization. We are not here to charge people plenty money. It's just a cost recovery basis. So thank you very much for coming to my facility to talk with me. I wanted people to hear about me, but I did not know how to do it. So I'm very, very happy today that I can meet you viewers so that you can come and benefit yourself.
Thank you so much. This is Grow Sierra Leone again to the world. Follow us on Facebook, subscribe to our channel and YouTube. Of course, chat for us in TikTok. You'll see us there. Grow Sierra Leone. You'll see more of this as far as it's for the development of our nation, Sierra Leone. Thank you. Share this video and God bless Sierra Leone.